Okay, so this is the called the advanced nursing skills. These are skills that are not every CNA is taught on the regular course. If you remember from the first section you took, the nursing assistant, these are additional skills that you're going to be learning so that you can be able to function in different areas of a facility of a hospital. This book covers all the pretty much all the areas in a hospital, including rehabilitation and other specialty areas. So you'll be learning a lot more skills that a normal nursing assistant does not. So there's going to be a couple of chapters in here that deal with phlebotomy, which we're going to skip over. And then also, I believe there's a chapter in EKG, which we'll be covering in depth as we continue the training. You haven't started that one yet, but we cover that one in depth. It's a whole new course by itself. So we'll be doing that one after this one. Okay, so this is the chapters in this book are pretty short, pretty easy.
Or is it a different book or it's the same one as the CNA?
Oh, it's a different book, and we're gonna ask you guys come by and pick it up later on today after afternoon, so that we can have it ready for you and have some materials that you can uh, you know some assignments that you need to complete. Some of the assignments are on here already. So if you click on the little hand with the paper, that's one of your assignments. The instructions for the assignment are right here. You click on this or this one, and it'll give you what you're supposed to be doing. What I want you to be familiar with is what a patient care technician is versus a nursing assistant. Okay, so there's a significant difference, but you have to understand that you're not going to be a regular CNA, but someone with more skills and more knowledge. So you're expected to obviously work at an acute care setting, like in a hospital, not just a long-term care, but in the hospital, and you should be able to function, be more, I guess, competent, you could say that. So that's the first assignment. I give you a CNA job description as well there that you can look at so you can compare the two. And of course, the PowerPoint that I usually go over in class, followed by a quiz, and then your test chapter one. Okay, I might be adding or giving you all copies of the workbook so that y'all can start working on it as soon as you can. So again, let's see how many chapters we got. I think we have about 12 chapters, 10, 14, 15. Yeah, there's about 12 chapters, minus the two, including the ones that I removed. It's a pretty straightforward information here that we're going to be covering on a daily basis. Usually we'll be doing at least two chapters, okay, per week since they're very short. Okay, I'm not asking for a lot of assignments, but you see here, look at the link here, and then you click on the assignment.
Sure.
There's, yeah,
I think Janie's trying to get in the meeting.
she's already admitted.
Oh, okay.
Um, so chapter two is just skills. Okay, there's some videos here that you can watch, and these are some of the things that we're going to be practicing here in class. Uh, so you can be familiar with what is creating a sterile field is, and why do we need to practice a sterile technique, and so on. And that's chapter two. So it's very short, very straightforward. Chapter three, we'll be talking more about wound care, what it is, what your role is, how much you can do. There's actually some jobs that or some facilities that allow you to work as a wound care technician, right? If you really like wound care, you really like it a lot, you can actually become certified for through other agencies. And if that's what you really like to do, then by all means. So we'll be looking at wound care and what it is and how to perform it and within your scope of practice. Okay. And I have a lot of wound pictures here. Advanced wound care, how to clean the surgical incision, which is very, very easy. Wound care links. I put some more wound care. There's a picture one of the wounds that I treated a while back. Okay. So that's chapter three. It talks a lot about wound care. It goes into depth. So We'll be meeting at least once a week, all right, so that we can discuss some of this information and you get more familiar with. Later on, we're going to be talking about the urinary skills. Now, you already, you should be familiar with taking care of a urinary catheter. We practice that in CNA, and if you don't remember, we'll go over it once again. Catheter care, perineal care. But this, in this section in chapter 4, you can understand more why people get urinary catheters. Why are they in there? Why don't they come out? Who needs them? And of course, I'll show you how to insert a urinary catheter. All right, it's very easy. It requires sterile technique, which is covered in chapter 2. So you'll be familiar with how to do that later on as we progress. So those are, again, hands-on skills that we be practicing here. So whenever we come here, we'll learn about sterile technique, and then we'll learn about how to insert urinary catheters. If you had a baby, you might have had one already, so you know what that's about. There's a video here. Oh, there's a PowerPoint. This symbol, it means it's a video, so you can watch that video. And then just the test. In chapter 5, we're going to talk about advanced nursing or nutrition skills. In CNA class, we talked about in chapter 8 about nutrition in general, what older people need to be eating, you know, so that you can help them meet their nutritional needs. But in this section, we'll be covering more advanced skills like nasogastric tubes, how to handle them, how to care for them, gastrostomy tubes, and other different ways that people can get nutrition when they cannot eat orally. So this is another area that you'd be familiar with that normal CNAs do not have, okay? And this is a video that you can watch later on. Chapter 6 talks about respiratory skills. If you haven't already, I would encourage you to, well, I'll give you an overview of what the anatomy of the respiratory system is and the functions and all that, so you can have a good idea of what the respiratory system does for us and why you need to help residents, how to care for them with their oxygen needs. How do you know when a patient is not doing well respiratory wise and so on? So sometimes I wish I could have you guys in class because it's a lot easier to demonstrate. But we'll go into the different complications that can occur respiratory wise. We skipped 7 and 8. Okay, so we go to chapter 9. I believe 7 and 8 are, yeah, 7. Yeah, chapter 7 is phlebotomy, and then chapter 8 is EKG. So I skipped those. All right. So chapter 9 is about rehabilitation. In CNA class, we talked a little bit about rehabilitation. You're going to learn a little bit more about what that has to do with in a rehabilitation center, outpatient or inpatient rehabilitation. It's a little bit more in depth than the section covered in CNA. Some of these things might sound repetitive, like the rehab section, but you should have a little bit of knowledge as to what range of motion is, prosthesis, and some of those things that we covered in CNA. Chapter 10 is the care of the surgical patient. I worked in this area in the hospital for a few years, about 8 years, caring for people post-operatively, what it means, and what is your role. And believe me, it's very, very important that I work with CNAs that are knowledgeable and that they know what they're doing when caring for a patient that is post-operatively. I'll not only explain to you what the book says about caring for a surgical patient, but more like a hands-on, like a real, what you really actually see in a setting, right, in a hospital setting after they come back from surgery. There's a lot of things that can go wrong after somebody has surgery, and we'll have to look at those so they can have a good knowledge and understanding of what caring for a surgical patient is. 11 and 12 are pediatric care. How to work with children, right, that are in the hospital. It's a completely different setting than working with adults. I don't have a lot of experience with kids. I never really cared for it. But if that's what you like, you as a PCT can work in maybe one of those hospitals that are specialized with children. Are any of you interested in working in that area?
No.
No? All right, you have enough kids at home, right? So obstetric patients, obstetric is for pregnant females. So if you're one that would like to work with females that are that are pregnant, there's three different areas. There's pre-labor, right before they start going into labor, and then there's active labor and delivery section, and then there's you have the postpartum. They call it a postpartum. There's antepartum, labor and delivery, and then you have postpartum. After they have the baby, you have to care for the woman, right? So that those are three sections that you can also work as a patient care technician. But you have to understand what the phase, what the woman is going through after after they give birth. I know you all have experience in that firsthand, but as far as caring for that person, you get some knowledge in that. And let me see here. Psychiatric patients. This is an area that a lot of people are not aware about, but there's a big demand for psych techs, okay, psychiatric technicians. You as a patient care, as a CNA, as even medical assistants can work in this area. They even hire EMTs, right, emergency medical technicians, to work with psychiatric patients. Now, I don't know, some people are afraid of people with psychiatric problems, but you shouldn't because they're very normal people. Many times you can't even tell these people have psychiatric imbalances if you don't talk to them, right? It's not until you start talking to them or somebody tells you what the conditions are, and then you get to know that, like, oh, okay, this person does need some help, right? And it's not that bad as it sounds. I know the word psychiatry sometimes scares people, but you shouldn't be afraid, and you should actually consider one of these jobs area because they're in demand. There's a lot of people that need mental health, and there's a shortage of people to work with either adult psychiatric or even children psychiatric patients. So there's for both. There's adults and children. Anybody interested in that psychiatry?
No.
Tampoco. Okay.
No.
All right. Last chapters are medication administration. We'll be going over some of the most common medications. You don't have to learn all the names of the meds because it's really impossible. But we learn them by category, the types of medication. What are they for? Are they for the respiratory system? Are they for the kidneys? Are they for the lungs? Whatever it is, we learn them like that, and then we learn the general term, and then maybe a few names that are very common. But for the most part, giving medications themselves is not in your scope of practice, but you can, if you wish to work in that area. There's a course called medication aid. We don't have it. I really don't care to have that one, but you can become certified as a medication aid through the state of Texas, and that's all you do. You just give oral medications to patients. I work with medication aids all the time, and technically I'm their supervisor, but they just ask me questions here and there about what it is, what a medication aid does, and that kind of thing. But of course, it's you have to be knowledgeable in the medications and the type of drug that it is, and so on. So it's another area that you might again want to pursue later on. But if you have other goals like going into nursing, you're gonna get all this training and some more. Okay, we learn a lot about everything in nursing. We get tested in like 12 different areas for the national exams, but it's very interesting. So those are the all the chapters, and again, they're very short chapters. So we'll be covering maybe 2 or 3 chapters per week, and it's not a lot of assignments that you have to do. So please stay on top of it. If you haven't already, go ahead and bring in all your worksheets so I can input all the grades and give you your final grade. So for those that just came in, we're going to start already in patient care, chapter 1, like I said, and they're very short chapters. So keep up with it, and we'll be done probably in about, hopefully in about 3 weeks with this patient care thing. Erica, good morning. I know this is the last section for you, and we need to start working on a resume. If you don't have one already, you start working on a resume so we can start looking for a job. Okay. Now you will be required to test for patient care technician. Some people tested this last week, and thank goodness they were all successful. If you are still considering it, by all means, we're here. Just tell me ahead of time that you want to test, because if you choose later on to work as a phlebotomist in any area, you will be required to have your certification. Okay, most places do not allow you to work as a phlebotomist without your certification, if that's what you want to do. All right then. So anybody have any questions on this next section on advanced nursing skills? Anyone have any questions? No. All right then. Then let me share another screen. All right, can everybody see that screen?
Yes.
Yes.
All right, great, 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 great. I'm trying to make it bigger for some reason. It's kind of small, but I think y'all can see it. Okay. All right. So as I said earlier, you will be prepared to function in an acute care setting. Acute means urgent, right? So it's the opposite of long-term care. Okay. So if you need urgent care, like emergency care, obviously you go to a hospital. In the hospital, you receive a lot of different kinds of services, including obviously physicians and nurses, and there's rehabilitation or physical therapists and so on. We are all called skilled personnel or skilled services. What that means is that the insurance companies, when they pay for anything, it has to be provided by a skilled person or somebody that was trained to perform a job. For example, I'm a professional nurse. I was trained to provide services like that. So those are really called reimbursable services, and insurances are willing to pay for it. So you go to hospital, it's a high level of care in the beginning. If you go into the emergency room, which to me would be the ideal place for a patient care to work. Why? Because if you're a patient care technician and you have multiple skills like venipuncture skills, EKG skills, nursing assistant skills, and the advanced skills that we're going to be covering in this section, to me, you are the perfect candidate. And honestly, this is why the PCT came about, because there was a shortage of prepared or skilled people. If I work in the hospital in the emergency room and there's only so many nurses and there's all these patients that are needing my help, I need somebody to help me, somebody to at least to do some things that I can tell her, hey, go put an IV on this person, go do a Foley on that person, or go check on this patient. That's the kind of person that I need to be assisting me, right? So the nurses, or the registered nurses, are extensions of the doctor. So whatever we do in that setting, the doctor usually supervises us or tells us what to do, right? He's the one that gives the orders for the care, and then we implement those orders. And then when we have help with people that can actually do things for us, then that's the kind of person that we need. We need somebody that can be an extension of us, right? Like multiply yourselves. And if you think about it, if you become this person that has so many skills, you're what we call a very marketable person. You're not can just be working one place, but you can work in many different areas if you choose to. And then hopefully you'll end up staying in one place. All right. Now, if you don't like that, well, maybe you want to work in a subacute care unit. Subacute, sub means under, right? Acute means urgent. So not so urgent. There's a lot of new facilities that are that provide skilled services, such as long-term care centers like the nursing homes. They provide physical therapy, rehabilitation, but we also provide other nursing services or skilled services, such as IV therapy, management of catheters, urinary catheters, feeding tubes, and so on. So you, with this knowledge, you might also be able to work in such a place. Rehabilitation facilities, there's just a bunch of them. There's adult rehabilitation, inpatient, and then there's other areas they call it outpatient rehabilitation, where people go in, get therapy, and then they go back home. And there's those that stay in there, right? they're in a hospital and they go and get therapy, or the same facility has like a big rehabilitation unit all standalone by itself. So you can work in those areas as well. And then there's some facilities, they're called long-term acute care settings, or known as LTACs. If you've heard of a facility called Solera, it's called Solera Hospital. It's actually located on the eighth floor at McAllen Medical Center. It's a hospital, supposed to be a hospital, standalone by itself, but it doesn't really work that way. It's just required to be called a hospital, but it's not. It's a long-term acute care setting, meaning they provide high level of care, but they can also provide it for a longer period of time. Not like the hospitals where you go in and then you got to get out. These facilities admit people that are very sick, that require a lot of care, and they're going to be there usually about at least a month or so. Right after that, they can be transitioned into a longer term care, such as a nursing home. So, and this facility, Solera and LTACs, facilities like this one, they actually pay very well. So if you are looking for to get paid decently, Solera Hospital is one of the facilities that you want to consider. Rehabilitation, they also provide rehabilitation services in there as well. A person's home, some people get hospital skilled services in the home setting, like in home health. Home health in itself, the industry is kind of like dying out. It's very slow right now. There's not a lot of positions or patient care technicians in the home health. So I don't really encourage you to work in there. And plus, you really are not going to get a lot of experience. You might function solely as a home health aide, which you all have to be as a CNA to be a home health aide. So I don't usually encourage people to work in home health in the beginning, maybe after you've gained some kind of experience, but not until then. In the hospitals themselves, there's a lot of different areas. And earlier I discussed the different chapters, and a lot of those hospitals have different areas where you can function. I talked about medical surgical, and that is my specialty. That is what I worked for in the hospital for several years, and how to care for people with many different types of problems, medical problems. You learn a lot in that facility. And that's what I chose to work in there because I wanted to learn a lot. And I did. Over 10 years, I worked in there, and any problem, medical problem, I probably saw it. Okay. So I have a lot of knowledge and experience in medical surgical care. You have to manage several patients, usually 6 to 8 patients, all with different levels of care. Some are very sick and some are not so sick. You just have to learn to manage your time wisely. So, but medical surgical care, it's a fast paced. There's no time to, well, I won't say super fast, but it's fast. Fast is like the emergency room, and then you have your probably the next medical surgical units, and then there's a bunch of other ones like ICU is very, very slow. And OR, the operating room, is also another room that is very fast paced. It doesn't seem like that, but it is fast paced. There's a lot of things that need to be done. You can probably work as a what is it called, a surgical technician. If you want to learn that, they might train you to do that. Some facilities will train you if you show interest in doing that. The labor and delivery unit, again, for those that are interested in working with females that are pregnant, either stage of their antepartum during labor and delivery, or after they give birth, which is postpartum. So there's different areas that you can work there as well. Rehabilitations, I just discussed it. Psychiatric units, I mentioned it earlier, right? A lot of people are afraid of patients with psychiatric problems, but they're actually very, very interesting. And they're normal people just like us. You cannot tell they have psychiatric problems until you get to know them. Dialysis units. This is another one. This is a lot of work in this, especially here in the Valley. There's a lot of dialysis clinics that are open for us to go work in. I can work there if I choose to. You as a phlebotomist, if you're already certified, if you're a CNA, if you're a patient care technician, they actually hire patient care technicians a lot. The hours are long, but you only work for like 3 days, and then you're off for 4. It just depends what you want to do, the kind of schedules. If you have any questions about the hours, the schedules that they offer, just ask me and I'll explain to you. But I think the starting pay for dialysis units is about $12 to $13 an hour versus the regular floors. They're a little bit lower, usually about $10, $11 an hour. Which one of the facilities does not offer acute care?
You're a nice teacher.
I don't think we mentioned it, right? Hospice, hospice care. I didn't talk about it, but hospice care is a service that is provided to patients that are determined to be terminally ill. If you're terminally ill, it means that you have, a supposedly a certain amount of time to live, right? It could be a month, 2 months, or sometimes even years. Like Alzheimer's is considered a terminal illness, but it's not acute care. It's not acute. It's not urgent care. In hospice, we provide only what we call comfort care. We provide care for the person to live a quality of life, not a quantity of life. So it's more about spending the last months or years under with their family instead of trying to worry about years to come. Is anybody interested in working in hospice? No hospice.
No.
No.
Some people think it's depressing, but if you really think about it, if you work in a hospice home health, it's usually a home health setting. There's actually other facilities that have patients that go in there to live their last days. And what's the name of the facility? It's in Edinburgh. I forget the name of it, but they also hire PCTs or CNAs to work in that area. An example of a person that requires urgent care or illnesses are people that have they're suffering a stroke or a heart attack. What are the signs of a stroke? Can any of you recall the signs of a stroke? And there's an abbreviation that we use, right? An acronym called FAST. How do you recognize a stroke? Do you remember what FAST means? FAST, F-A-S-T. It's what? Facial drooping. F is for facial drooping. A is for arm weakness. Okay. S is for speech, slurred speech. And then T is for time. So if you recognize a stroke, remember that. The drooping, the arm, the speech, and time means that you have to get them immediately to the hospital so they don't suffer long-term sequelae, right, or complications. A person that has a heart attack or suffering a heart attack might need acute care. You have to recall what are the signs and symptoms of a heart attack. There's a lot of them. Females are different than men, but of course the chest pain, the numbness in the arm, and the pain in the neck or the jaw, sometimes the back, right? They start sweating. We call it diaphoresis. They begin to sweat. So a person like this obviously needs to go to the emergency room. Okay, so you should be able to recognize those symptoms of a stroke or a heart attack, or it could be something else. It's shortness of breath. All of a sudden, they might need to go to the hospital. People that have chronic conditions, there's some chronic conditions that you're going to see over and over again. Okay, one of them is congestive heart failure, and we talked about this I think in CNA, and we also talked about it in EKG, and we'll talk about it more. What is congestive heart failure? It's a chronic complication. I have patients that have congestive heart failure for many years, and they're still alive, but they have a very low level of quality of life. They can't do a lot of the things that we like to do, and it's one of the most common problems that you have. So you have to understand what a congestive heart failure is, so that you can know how to help this person, how to manage the condition, which is very, very important. Conditions like COPDs, chronic obstructive pulmonary diseases like asthma, emphysema, people that smoke for many long times. What happens to them? What happens to their lungs? How does it affect their overall body systems? I'm gonna go back and illustrate for you guys how to perform holistic care, right? Care of the entire person based on one condition. Okay, we do we do in nursing school, we do something called a care plan, a care plan. So it'll help you think about every other body system, right? For example, smoking. Smoking, well, we usually think about like where your lungs, yes, your lungs, right? Are going to get damaged. You're going to have impaired oxygen exchange, less oxygen in your lungs, so therefore less oxygen in your bloodstream. That means there's less oxygen to the rest of your body, including your heart, including your brain, including every other organ, right? What does smoking do? It's not just about the lack of oxygen, but the nicotine that damages your arteries and your heart gets enlarged, and it becomes a very big problem. I'm gonna when next time you guys are here, I'll explain it to you so that you can see and be able to think a little bit more holistically. Okay, so you can see every other body system, right? So congestive heart failure, COPD, HIV. Uh, HIV is a virus and develops into AIDS, autoimmune disorder. How does that affect the person's entire body, their psychiatric body, their heart, their lungs, their kidneys, and so on, the family, the psychosocial areas of the person? So there's a lot of things that we have to think about when we are caring for a person. It's not just about that condition alone. We have to think about every other thing. Okay, pneumonia, again, we're in flu season. There's a lot of people that are going to be coming up positive, not just pneumonia now, but stupid COVID. So pneumonia is a big thing that affects a lot of people very commonly, even when it's not flu season. So you have to understand what pneumonia is and how does it affect the body. So I'll probably be giving you just like a quick assignment. You're going to tell me what a condition is. For example, pneumonia, what it is, how does it affect the lungs, and then how does it affect the rest of the person. So those are some examples of patients that require acute or urgent care that need to go to the hospital. Okay. Um, so again, approaches to holistic and humanistic care. When you are working with someone, it's very easy to show your frustration. Very easy to, uh, your body language shows everything. Okay. So remember to be empathetic and put yourself in their position. How would you feel if you were that patient? How would you like to be treated, right? We think about the golden rule. Do unto others as you would like for them to do unto yourself. So think about that. Okay, act with empathy and compassion. Compassion just means showing a little bit of concern. It doesn't mean like, oh, we have to be there all the time. No, just show concern. How do you show concern? Spend an extra minute with them, listen to them. Hey, how are they feeling? How do they look? Do they look sad, angry? Can you do a little bit of something for them? Something like that. That's a little bit of compassion. Calling them up. If you have a family member in the hospital, you call them up and ask them how they're doing. That's showing compassion, right? Have respect for the person. Obviously, it means you understand them, you accept them, you don't judge them. If they come in with a condition like HIV, you're not going to judge them. Oh, well, this person probably was a bad person. They did something wrong, right? We don't do that. Okay, we don't do that in healthcare. We don't judge people based on their conditions. We help them. We treat them. Uh, we help them. The goal is for them to get better. So always consider the whole person. Okay, the whole person. It's you, the person, your name. Okay, for example, let's say we know Janie. We know Janie because, well, we recognize her. That is her name. That's Janie. And then we don't know the other Janie, right? Not that you're multiple personality, but Janie, the mother, Janie, the wife, Janie, the daughter. Okay. We don't know the spiritual side of Janie if she has one. We don't know the emotional Janie. Is she very, happy? Is she outgoing or is she very shy? What kind of person is Janie? That's her mental side, right? Psychiatric side of Janie. Her physiological side. How is her inner systems working? Does she have any medical problems, any hypertension or anything like that? So we have to look at that as well. So psychiatric, emotional, physiological, physical needs. Does Janie has she met her physical needs? Right. So we have to look at all the entire person. Okay. So I'll go into depth later on whenever we meet. So consider the whole person, their emotional, social, spiritual, and every need that they might have. Okay, even psychosocial needs. Okay, we all need support when we're in the hospital. It sucks to be alone in the hospital. Treat each person as a unique individual. Every person requires different care. No matter if they have the same condition, they're going to be completely different. So the care we do for one person is going to be different than we do for another one. So that's just the way it is. Remember privacy, guys. Privacy is very, very important. Never always make sure that you close the doors behind you, put the curtains. Okay, so show to the patient that you care about their privacy. Call them by their name. Don't call them honey or grandma or grandpa or things like that. Just keep it professional. It's very easy to sometimes get maybe a little bit attached to them very quickly. If you're that kind of person, you might want to, step back and consider just being professional. Be a good listener is one of the best things that you can do. Or sometimes patients they want to say something, but they don't because they know that we're always in a hurry, that we're always in a rush doing things. And if they see us, showing that we're in a rush, well, they're just going to hold back and they don't want to take their time. They don't want to be a bother. So they're not going to tell you anything. But if you show a little bit of concern, a little bit of compassion, and be a good listener and ask them, how are you doing? Is everything okay? You know, if you notice them, I see that you look a little bit sad. So inquire, ask, if the problem doesn't pertain to you, then you relay that to the nurse or whoever that problem needs to go to. Take the time to get to know them, but don't get personal. Don't cross that, that line, that professional line. Um, find a little bit about them. Ask permission before touching. Remember, cultural ideas vary from culture to culture. Hispanic culture is not very touchy-feely. So if you're a female, it's kind of okay. But as a male CNA or nurse, many times we have to be aware that we have to be conscious and as to, the distance and the touch and eye contact and so on. Maintain a patient's privacy during care, especially with documentation. If you have a patient's information, you should never ever leave it open for viewing, especially computers. Nowadays, everything is in computer. Yeah, yesterday we had an audit from the state. They came to the facility, and one of the medication aides was passing out her meds, and she got careless, and she left the screen open and the patient's information was there. There's a picture of them, there's a name and all the medications and all that. And she was taking a couple of steps away and the state auditor happened to be right there next to her. I guess she didn't see her or something, but she got cited, or the facility got cited for that. That's a violation of HIPAA. And it's not just about like getting written up, it's about uh, financial expenses. The state will fine the facility for that violation. So it's very, very important that you make sure that you don't share any information with the patients, from the patients to anybody, including leaving screens open. All right, factors contributing to the changes in healthcare delivery. Well, every 4 years when there's elections, things change. You remember from about 8 years ago, we all had to enroll what they called it. People know it as Obamacare, but it was actually called the Affordable Care Act. That created a lot of changes in the medical industry. Okay, you might not see it as an employee, but as an employer, right? If you're working for a hospital and the government, who's usually the main payer source, says, well, now we're not going to be paying you for this, we're not going to pay you for that, and you have the same employees, you have the same expenses. How are you going to do it to make it? So you have to manage, you have to start to get creative, okay, with all these increasing costs of healthcare and less reimbursements and so on. It gets very, very challenging sometimes. And a lot of people end up losing jobs because of the changes in healthcare. We have a new administration coming up next year. God only knows what's going to happen as far as healthcare expenses are gonna the changes that are gonna come up. So we'll be waiting for that. Insurances are the ones that pay for most of the expenses. We have Medicare and Medicaid. We covered this in CNA. Medicare is for people that are 65 and older or have a physical disability, such as maybe dialysis or they had a stroke and so on. Medicaid is for people that qualify for it. You have to financially qualify for Medicaid. There's also nursing shortages, guys. Believe it or not, there's always a shortage of staff. Always. Where I work, there's always a need for more staff. We never have enough because people move in and out. You know, they come in, they start working, and then they say, "Well, this is not for me," so they leave. They go to another facility, and same thing, and it's just a vicious cycle. Some people go in to get more education, which is great. Okay, but even nurses, they come in and they stay for a while, and then they take off, they go take another job, and so on. So the turnover in healthcare, I would say it's not that great. Okay, it just depends what your employers how they treat you. Okay, so there's always a nursing shortage, and there will continue to be a lot more. Okay, as far as healthcare is concerned, why? Because there's a very big population that is retiring, has been retiring for the last 5 or 10 years, and those are called the baby boomers. The baby boomers are the people that were born in the 19 after 1943, after the Second World War. So right now, those people are about 65 years old, and a lot of them are retiring. And not only that, but they have medical problems. So they're retiring, they can't do for themselves, and they have medical problems. So that increases the demand for healthcare providers, for CNAs, for nurses, for doctors, and so on. So that is another reason why we have an increasing shortage of nursing staff all the time. Healthcare facilities attempts to control costs, but still meet patients' needs. Again, that's one of the challenges that continues. Um, Employers always find a way to make it, okay, to continue to provide the services and keep their employees and nobody losing their job. But it does become quite challenging at times. Question, which of the following is a factor that has contributed to changes in healthcare? It's the shortage of nurses. Shortage of nurses. There's a shortage of professional nurses, registered nurses, not so much LVNs, but more RNs. Everywhere in the country, there's a shortage of registered nurses. So if you want to go that route, that for sure you will always have a job. It's recession proof. It's one of the industries that you're always going to have a job, just like teachers, except teachers don't get paid that much. But healthcare is one of the big industries that they're always going to be work for you, always. All right, let's take a quick break, guys, and we'll continue. If anybody has any questions, please let me know. All right, so we're continuing conversation here in the patient care technician course, chapter 1. We discussed the different areas where a patient care technician can work in, and in every facility, there's going to be some areas where they're going to require you that you become a cross training. What it means is that you're going to be actually given an opportunity to learn different areas of the work. So you may not just be working doing, for example, patient care work or phlebotomy or things like that. It may be, let's say you end up working in a hospital and you're working as a phlebotomist. You might actually be asked to cross train and be involved in the lab, in the processing part of the lab or other areas within the lab. So you should really take that opportunity to learn more and be more useful in that facility. Why? Because these are skills that you can take with you. That knowledge, that training that you get there, wherever it is, you take it with you. And when you work in another facility and you add these things to your resume, right? So I'm gonna need for you guys to start working on your resume if you don't have one already. And you need to start adding the skills that you have already learned, right? Any nursing assistant skills, phlebotomy skills, EKG skills, whatever it is that you have learned so far, you need to add it on to your resume so that when you post it up in one of these job ads, like Indeed or Monster or any other job ad, your when your resume has those specific words, okay, and I'll go more into that later on. When the job sites see these words in your resume, because everything's digital now, right? These systems, these softwares pick up all that information, and they see that you have these skills. You're going to have a lot more matches as far as employment opportunities. Okay, so it's really important that your resume be very closely tied with what employers are looking for. So how do you know what they're looking for? Well, if you go to a job site, let's say Indeed.com, and you search phlebotomy, and then these job sites, these they come up, and if you look at the requirements that they want, okay, the skills, or they say phlebotomists must have, uh, obtain or must be able to collect venipunctures. So your resume should say collect venipunctures. The phlebotomist must handle uh, privacy. Your resume must reflect that as well. So you want to almost copy those keywords, okay, into your resume so that your resume will stand out. All right. You don't want to put all this other history that has nothing to do with the job that you are looking for in search of. So it's important, not saying that you don't want to put your work experience. No, that's not what I'm saying. Is that other skills that are already in your history, like the past, you're moving on to healthcare industry now. So your resume should be a little bit more representative of what you're looking for. Okay. So you will be required to cross train in some facilities. Sometimes they ask you, it's optional, and sometimes they will not ask you. They'll just teach it to you. Okay. Why? Because they want to use you, and you should take that as a compliment, because some facilities see the potential in you, and they say, you know what, this person is fast learner. She she's a team player, right? And whatever they say, but they see that you were a good worker, you're reliable, you're dependable, you're professional, and so on. And that speaks volumes, guys. Your work, your actions say more than what you may say about yourself. Okay, so you may get cross-trained in different areas. You might even learn things that you thought you couldn't do, but this is the only caveat, right? If you learn how to do one thing that is not in your scope of practice, let's say in a hospital, and you go to another hospital, don't expect to be able to do the same things there, because that facility may not allow you to perform that. Okay, so unless they train you again the way they want you to do things, then you may be able to perform it. But other than that, some skills that you get cross-trained in one facility may not necessarily transfer into another facility. But you should always include them in your job experience, because the employers are looking for that resume, and they see that you know A, B, C, D, have all these skills and this knowledge, and they're like, wow, this person would be perfect for the job. Okay, and that's what's going to make your resume stand out. Okay, so remember that, be able to cross train, right? To learn different areas. So right now, um, some of you are already knowledgeable, okay, in how to perform an EKG. Not only that, but how to read an EKG. You know the arrhythmias. You know at least the most important ones. You know how to collect venipunctures, blood samples, and so on, capillary samples, and so on. Uh, what else? Transporting patients, nurse assistant work, and so you have a lot of skills that that need to go on your resume, because this is what we call marketable skills, skills that are going to help you land or obtain a better job. Okay, very, very important. Nursing assistants may have many different titles. Yes, in many areas they have they call them NAs, unlicensed assisted personnel, PCAs. I've heard PCAs a lot, patient care assistants. In Rio Grande Regional, they call them CNAs, PCAs. Other facilities call you a PCT, patient care technician, and so on. Regardless of the title, to me, nursing assistant is not the equivalent of PCT. A PCT is a person that has many more skills and knowledge. In my opinion, you're much better prepared to care or to be an effective a member of the healthcare team. Okay, that's just me. A nursing assistant, especially nowadays, is very limited in knowledge and training. So you want to be more prepared, earn a little bit more money, then of course you need more skills. Okay. What do the initials UAP mean? Unlicensed assistant personnel. So you are, even though you are certified by the state to work as a nursing assistant, you have a National Healthcare Association certificate, you're still not licensed. A licensed personnel is someone that that is trained in professional work such as physical therapy, nursing, doctors, lawyers. Those are all licenses that are issued by the state. They're supervised by the state. So it's a bit different than obtaining a certification or a certificate from the state. All right, some of the skills that I mentioned earlier, you're going to be learning is how to insert and remove a urinary catheter using sterile technique. Of course, first you got to learn what sterile technique is, why it's important that you learn it. Caring for tracheostomies, that is also a very good skill to have. It requires special training because having a tracheostomy here, a little tube inserted into the airway, it's really important that it be kept clean and maintained, and you'll be learning about that. How to suction in the oral or via the tracheostomy, really important that you know how to do that as well. Discontinuing intravenous fluids, I can show you how to insert IVs into a person. It's not really that difficult, not much more difficult than collecting in a venous puncture. So you'll be learning how to do that, how to discontinue it. Of course, the IV, that's also will be within your scope of practice in the acute care settings. All right, one more important thing I was just looking at, the job descriptions, kind of touched on it as well. When you look at the job description, make sure that you look, again, for the skills and the things that you're going to be doing, that you're going to be responsible for. All right, it's really important that you know your job description so that when licensed personnel, like a nurse, wants you to do something, okay, it has to be on your job description. If I delegate something to you that you're not trained to do, then you should not do it. It's not in your job description. Okay, so make sure you know what you are responsible for. The skills you're expected to do might differ from one unit to another. Of course, if you're working in the ER, it's way different than working in the medical surgical floor. You might not be able to do the same things, even though if you can. So you just have to make sure that you clarify. You may be expected to learn more advanced skills aside from what we're going to learn here. Again, you may be taught different things. And again, these are crossover or cross-training skills that are good for you to learn and to take that knowledge and information and be able to carry them anywhere you go, even though they may not transfer automatically. If you ever have a question about doing something that, again, it's not in your job description or it is in your job description, but you're not sure, go ahead and consult with your supervisors also. Since you're going to be a new to a lot of these things, you're best off asking before you perform something that you're not comfortable with, such as maybe performing the trach care, performing suctioning and things like that, or inserting urinary catheters and so on. So that's all. Those are some of the things that you need to ask if it's going to be your first time. All right, increase responsibilities of advanced skills. As you become more trained, more prepared, you have to make sure that you be more professional. Okay. Sometimes we ask more of you because we know that you're competent and you're able to perform these skills. So make sure that that you always act very professional. Okay. Make sure that you're thoroughly trained and comfortable in the advanced care skills listed in job description. But more so, make sure that you ask guidance. Okay. Ask for someone that can help you at least maybe the first time or watch you the first time. If you're going to be doing, let's say, an IV for the first time or insertion of a urinary catheter for the first time, make sure you ask for assistance. Or you maybe want to watch the nurse, the first time. But you're going to have to make that jump eventually. Report to the nurse any observations that may indicate a change in a person's condition that is within your scope. All right, so this is one of the most important things that we have to do, everybody. We have to be very observant. We have to make sure that we monitor patients as they progress because sometimes they might digress. In other words, they may get worse instead of better. So we have to make sure that we have a good idea of what the baseline condition of these patients are. Okay, if you saw them, they were talking to you, alert, they know where they are, they know what's going on. And then all of a sudden, they seem confused, they seem out of it. You know, they're talking things that are have nothing to do with the care. That you need to report these observations right away. You must be available to assist nurse skills. Okay, that you may not be responsible for. If you've new to a facility and they ask you to do things that are within your scope of practice, you must be available to perform those unless, again, you're not comfortable with yet. You will be required to obtain CEUs as a nursing assistant. It's 24 hours every 2 years. Most facilities, hospitals, nursing homes, they will provide you those CEUs during your work there. Okay, they're not optional; they are mandatory. You have to complete these 24 hours within the 2 years because the state comes in and audits your employee records, and if there is no records of you completing those 24 hours, then you're technically your certificate is expired. All right. There is 12 CEUs that are available for free at the DADS website. Texas Dads, just CEUs, Google it, and you can find there's 12 of them there that are free. If you don't get them from your employer, then you have to obtain them. You have to pay for them for the other 12. So again, your certificate is good for 4 months or 2 years, and you must complete the CEUs. So you will be getting a lot of what do you call it, in services or in services trainings about different areas in your care, like infection control, safety, preventing falls, preventing UTIs, and so on and so on. Okay, so continuing education is necessary to keep up to date with changes and in healthcare. Ask questions. I know we have a lot of questions about the do's and don'ts of a nursing home. I had never worked in a nursing home before, and this is something that I need to bring up to the company because when we get audited like this from the state and they just show up random and they start asking you questions, you know, we're like, we don't know the answer to. We may give an incorrect answer. So you must always ask questions about the functions, you know, of a facility. You will get orientation. Don't panic. You will get orientation anywhere you go. Most facilities, I'm talking about larger facilities like hospitals and nursing homes, they will give you training or orientation rather, at least for if not a week, 2 weeks, so that you feel comfortable and kind of blend into the routine. Hopefully, you have a good orientor, right? A person that will orient you in the overall daily functions of the work in your particular shift. So that's usually the way it works. If you can read materials, read journals. Don't just whatever you learn from here and then that's it. Forget about it. No, you got to keep on learning. Always keep learning more about the profession that you're going to be working in. Take advantage of those in-services that we had. We just had an in-service on tracheostomy care. Right, it's been a while since I've done tracheostomy care, so that in-service is actually pretty helpful. It helped me to remember a lot of the things. Stay motivated and keep learning and growing as a professional. Again, the more training that you get, even if you get it on yourself, let's say you like EKG and you want to learn more about EKG and you're really into that thing kind of stuff, there's in services, there's seminars, there's webinars nowadays that you can, learn from. So don't keep yourself, don't limit yourself as far as learning because there's, you never finish learning. So is this true or false? One way to keep up to date on skills is to attend in-services education at your facility. Obviously, that is true. And a lot of the times they will be mandatory. It's not optional. So make sure that you attend those as a need be. I think some facilities need a lot of education. They need to push more their education as far as their employees are concerned. I really need to bring this up to the facility where I'm working at. I don't know if there's such a thing as an educator. I know hospitals have educators for sure. That I do know, and they're always coming around and they're giving us quick in services, and they do mock surveys, like they come in and they'll randomly ask you something, they get you off guard. But guess what? That kind of helps you remember things and keeps you on your toes as far as being prepared for audits and surveys from the state or any other accreditation agency, because they do come in here randomly and they start asking you stuff that you might have forgotten. So again, there's nothing wrong with getting quizzed, at some point. Quality control, we touched this on the other, I think it was lobotomy, right? Quality control. Why do we do things the way we do them? Well, because of quality control, we must ensure the safety of the public. That's what's most important, okay? There's a lot of agencies that check us, okay? To make sure that we're doing things the way we're supposed to, like the state agencies. In phlebotomy, we talked about OSHA. Okay, we talked about Joint Commission. Joint Commission again is involved in a lot of different areas in the hospital, not just the lab or the nurses, the nursing area. No, they're involved in everything in the hospital. So they may come and ask you questions, and they help us stay to be able to deliver better healthcare all the time. So healthcare workers are properly trained and competent. Of course, that's why we get certified and we stay up to date in the in-services. Healthcare facilities meet standards of cleanliness and quality. That's more like an OSHA agency, and they do come in and they check for any lack, of following the guidelines. Healthcare is available to everyone. It's optional. Everybody has the option to enroll in healthcare or not. It's completely your choice. Independent organizations exist to help ensure that facilities provide quality healthcare. Again, that's one of them is Joint Commission. It's the biggest one, the most prestigious one. Okay, they offer that gold seal of approval. And again, if your facility meets their guidelines, their requirements, then you are accredited by Joint Commission. And that means that your facility is working above and beyond the state guidelines. So the state is right here, Joint Commission is working over here. So where does your facility want to be? They want to be at the minimum, or they want to be above and beyond. Okay, that's what Joint Commission does. And again, this is all to help us deliver safer care, more competent care, and minimize complications. So we talked about Joint Commission back in phlebotomy. They've been around for a long time. They're not for profit, but they do charge a fee to come and visit your site, and it's completely voluntary. Your facility will have to pay a fee, and they ask Joint Commission to come in. And once they make their audits, I mean, they can make an audit in just one area, or they can make an audit in every single area of the facility, okay? From medical records to employee records, to nursing care, the clinical care, all right? There's just so many areas that they can go into and help improve your facility. And that's what they're there for, okay? So that we as a facility can improve, provide better, safer care for patients, clients, residents, for all these types of patients. And once we meet those criteria, those guidelines, then they'll give you the gold seal of approval. Now, your customers may not really know what the heck is that. They looks nice, but what does that mean? Well, it means that your facility is working above and beyond the basic standard of care. Okay. All right. Moving on to the next topic: 5 rights of delegation. Delegation. It means that what can I do? What can a nurse ask me to do, right? That is within my scope of practice, okay? So there's 5 rights of delegation. So I have to know what I can and cannot ask you to do, all right? So let's go through them. Before delegating a task, the nurse considers 4 major factors. Number 1, the state laws. I'm not gonna ask you to do something that I know you can't do, that you're not allowed to do, and that you were not trained to do, okay? We have standards of practice. There's actually a big book of nursing standards of practice, okay? It means that it includes delegation, okay? As a professional nurse, I can ask you to do something, but I cannot ask you for things that you're not trained to do, okay? Your abilities. If you are a brand new nurse, nursing assistant, a patient care technician, I cannot ask you, right, to care for a patient that is very complicated, because this may be way beyond your abilities, because you're pretty new. You're still learning and learning the ropes of the facility and the specialty area and so on. So I have to consider that. Are you new? Can you handle it? Okay. The facility policies regulating what duties a nurse may delegate to an NA. Again, it's going to depend on what area of the hospital you work in. In an emergency room, obviously, we can delegate to you if you're competent, if you have experience. We can ask you to do everything pretty much that we do as a nurse in a hospital. The only thing we can ask you to do is to complete assessments, like to go ask, evaluate a person, how is he doing? I can't ask you that. I may ask you like in general, like, is he breathing? Okay, is he okay? But I can't ask you like, well, give me an evaluation. Is he? No, because that is beyond your scope. Okay, you need a lot more training to be able to do that. So I have to consider those things. The assessment of a patient's condition is completely out of question. I cannot ask you. Okay, can I ask you for vitals? Yes. What are the vitals of this patient? And you tell me. What is the saturation? You know, what is the respiratory rate? And all those things you can tell me. But you're with your judgment, we shouldn't ask you like to make an assessment of a patient condition. That is not in your scope of practice, okay? Because that requires a lot more training. So remember that. If somebody asks you, how is the patient doing? What do you mean? Is he breathing? Yes, he's breathing. How is the vital stable? Well, yeah, the vitals are normal. Is that what you mean? Yes. Okay. But I cannot ask you, is the patient doing okay? And you tell me, oh yeah, the patient is doing fine. And then next thing we know, the patient is dead. Well, you told me he was doing fine. See, that is why I cannot ask you to evaluate a patient like that, to assess a patient condition. Okay, you cannot do that. That is not in your scope of practice because that's more responsibility that you are taking upon yourself. So make sure you clarify with the nurse. What exactly are you asking me? How is the patient doing? Is he breathing? Yeah. Is he alive? Yes. Are the vitals yet? Okay. Okay, then that's all I need to know. But I cannot ask you to assess a patient. When a task is delegated by the nurse, the nursing assistant is responsible for what? A, B, C, or D, recognizing which tasks are within her scope of practice, knowing her range of abilities, knowing what is the nursing assistant job description, again, your job description. And it's all of the above. You should know your job description. Again, you don't want some nurses to be delegating to you, to telling you to go ahead and give a medication. Here's medication. And like, that's not in my job description. You know, I'm sorry, I can't do that. Right? There's nothing wrong with saying that. As a matter of fact, if a nurse asks you to do something like give a medication, give an injection, do things that are not in your scope of practice, those things are reportable. Okay, the nurse needs to be reported because that's completely out of your scope of practice. Okay. Last topic here in this chapter is communication in advanced care. You must be able to communicate. We've mentioned in the other sections as well. Communication is one of the national patient safety goals in phlebotomy. And why? Because if we don't communicate with each other, then how is the patient care going to, come together? We nurses communicate with therapists, communicate with, the lab, with the doctors, and so on. CNAs have to be part of it. You're actually a big, big part of it, right? Nursing assistants, as we said before, the eyes and ears of nursing. And if you can provide that objective, evaluation. I'm not asking about subjective, just objective. What do you see? The vitals, the patient condition, things like that. But I'm not asking you to assess or evaluate the patient's physiological overall function. Just communicate to me. Your patient is having trouble breathing. Your patient looks pale. Your patient looks blue. All right. Those things we have to communicate. Your patient complains of pain. Very important. So again, we look at the whole patient. So we talked about holistic care before. Very, very important. So this is where it all comes together, guys. This is where all the things that you're going to be learning have to come together, and you have to learn to communicate. Very, very important. Again, your job is to closely observe, okay, and report your findings. Nursing assistants who work in advanced care settings are often responsible for recording their observations and the care they provided. Whatever skilled care, did you help them with personal care, or you're doing nursing skills, or you're measuring vital signs, input and output? What is that you're doing for the patient? Now you have to record it and document it. Of course, once you report it to the nurse, then it becomes that person's responsibility. It's no longer your task or your responsibility, but the nurse's. So remember, if you have a problem, the patient gives you a problem, if it's within your scope of practice to do it, right? If it's your job, your responsibility, then you take care of it. But if the patient tells you, well, I feel like, I just don't feel well, that requires that you do a complete evaluation of the whole clinical picture, which is not in your scope of practice. So you take that little problem and you take it to the nurse, and the nurse needs to do something with it. Okay? Yeah, you already gave the responsibility to the nurse, you reported it, and that's the end of that for you. Now it's the nurse's job to take care of that. All right? So again, make sure that you record your observations and the care you provide to the patients. Do not record before, right? You provide care. You have to wait until you do it, and then you record it. And don't record late, because you might forget. Okay, you must document in a timely manner. Very important, because a lot of times we forget things. Okay, we forget what we do, and then later it comes back to haunt us. Okay, like repositioning the patient, personal care, perineal care, whatever it is. All that is has to be documented, because that is part of what the services that are provided are part of the billing. So we get paid for all the services that we provide, but if we don't document it, then we just never did it. Remember, if you don't document it, you never did it. Okay, you're gonna hear that again and again if you continue into nursing. Communication, again, with the patients is also just as important, okay? You're gonna have to learn to communicate with the different abilities or disabilities of the patients. You may have to use body language, you may have to use expressions, gestures, hand gestures, you may have to write things down, point to things, and so on. Okay, it becomes a challenging sometimes because patients cannot tell you, especially if they had a stroke or they can't speak for some reason, or any medical condition or impairment they have. It's very difficult, but it can be done. Okay, we can make yourselves understood using maybe some pictures, right, or something like that. So again, we're going to have to learn to communicate. We're not all experts at communicating with every single person because they're all different, but at some point you will learn, nice different ways to communicate. Alternate ways of communicating include writing things down, pointing to a picture, body language. One way or another, we have to learn to meet the needs of the person, okay, at some point, okay? Very important that you learn how to do that. If you can't communicate with someone, then ask another person, ask them, can you understand this person, because I can't, all right? And I've done that a lot, even till now. It's challenging, but again, not impossible. And we will make yourselves understood. We will help the patients in any way that we can. When a patient is unable to communicate, the nursing assistant should ignore the patient, no. Only communicate with the patient's family, no. Not observe body language, no. We have to find alternate ways to communicate. All right, many times even the family members do not understand their loved ones. So we have to learn to communicate one way or another. All right. So we covered a lot of ground, a lot of topics in this small chapter. Communication, job descriptions, delegation. What does we cover? Acute care, different areas that you can function as patient care. So again, this is a first chapter, and there are some assignments on the online portal. So you need to go in there and complete them. The textbook, if you can please come by and pick it up afternoon. We'll have it ready here for you.